You work with doctors, nurses, and healthcare professionals every single day. What is the most common lie they tell themselves about their own health?
Honestly, we are very good at thinking that we know the answers to everything. I think that's the problem. So a lot of us don't want to seek help because we think, well, we're meant to know this and we think knowledge is enough. So to answer that question, literally, I see this all the time with my clients where you feel like, oh, knowledge is enough, then why have you not reached your target? Whereas implementation is actually, that's the thing that gets you the result. Actually having a plan that you can stick to and be consistent with. So definitely the knowledge, because we're obviously, we know what to do and stuff like that. That is a huge bit I see all the time.
Yeah, 100%. What does burnout actually look like in the body, not just mentally?
So everyone's really different with this. Everyone's got slightly different tells. So like for me, you can have like a nervous twitch, all that kind of stuff. But what I say for that is that burnout can be very silent at times, and you have to look at your environment. So a lot of the times, the people that know you best, they actually notice things in you. And sometimes we're not very good at listening to those around us. We are very good at powering through, say, I've got to do A, B, C, of all that kind of stuff. So burnout looks different from everyone, but the way in which you figure how you're on the road is listen to your loved ones. If they say that, look, you're not doing things that you usually do, or like, what's going on here? What's going on there? That gives you the signals that something's not quite right. So that's usually the time that we need to put changes in place, which we're not very good at giving this healthcare professionals. We're very good at let's go straight through if we're superhumans, but yeah, we're not.
Yeah. So at what point did you realize that healthcare professionals are perhaps some of like, the unhealthiest people emotionally and physically, despite knowing a lot of information to make themselves better?
Because I've been that person myself. That's the thing. So I can relate to my clients or even just to healthcare professionals, because if you think about it, we're perfectionists, but we're in a system that makes it very challenging. So you go from being perfectionist into a system that really constrains you, and you give so much to, then you end up neglecting your health, your fitness, all of these different things, because you're giving a service, right? And then when that happens, you forget about yourself, and that's why we're so unfit, unhealthy. We've got some of the highest kind of cardiovascular disease, cancer, all that kind of stuff, right? Because we are given service, we forget about ourselves because that's what the system does. So that's literally, because I've lived it myself. I mean, I don't know if you see my before and afters, but I've lived it myself, and that's why I resonate with that message so much. Yeah.
Understood. And what are the early warning signs a healthcare professional is heading towards serious health issues, but usually ignores?
Yeah. Okay. So you always, I guess, you think about your kind of stress markers, basically. So when I say stress markers, you might start feeling a bit more anxious in yourself going into work. You find a little task that you do quite easily. You're struggling to do them. Start with brain fog, and then you start withdrawing. So things that you found easy to do at work or at home, are difficult because you're making so many decisions a day. So you find that you're making less efficient decisions. When you get home after work, you're giving even less to your family and your loved one. And then that just spirals because it's literally like a feedback loop where when you get home, have no energy, then you go to work, you're performing, worse. You go home, you're more cranky with your family, and then it gets worse and worse and worse until something actually like something bad happens. So I always say that, like, that's where it spills into your patient care, and like mistakes happen, complaints happen, and all that kind of stuff. So from something very little, it can just like spiral negatively bit by bit and stuff like that. And we're not very good at going right to the source and making the changes before it goes to that, before it gets to that level.
And most clinicians will say, I don't have time, right? Is that actually true, or is something else going on?
I always say that you have to like connect with a reason why. So what is the reason why you need to make this change? Okay. So I tell everyone this example, like for me, I actually had health issues. I was pre-diabetic. My blood pressure was up, and I was actually struggling to play with my little girls. I've got two little girls, and literally I was getting short of breath just like playing with them. If you connect with the reason why, and if it's strong enough, then you could audit your time, audit your lifestyle, audit your rota, and create a plan that actually fits in with that. Because there's nothing as important as your health that permeates your patient care, how you run your business, if you've got a clinic or a GP practice, how you show up for your family. So all of these things are affected. So it's not just about, oh, I don't have any time. It's about, if you can't show up and be your best, that's your life. That's all the stuff that you handle. So yeah, there are challenges. Me as a health professional, I understand what the challenges are. So there are challenges, but we all start with your why. Like, I think you're an avid reader, right? So Simon Sinek, start with why. Start with your why. And then when you start with that reason, then you can find ways. Like people find ways to kind of get through their exams, do your night shifts and all that. Doctors and health professionals do all sorts of stuff. So there's no reason why looking after your own self can't be the same as well.
And if a healthcare professional only had like 20 minutes a day, what actually matters most to do in that time?
Perfect. So when it comes to, I guess, I'm a kind of fat loss expert, and that also affects how resilient you are and all that kind of stuff, right? So with 20 minutes a day, look at things that, if it's a clinic, look at things like that don't need much time. So what's your hydration like? What is your sleep sleep like? Because sleep affects your performance, but also impacts your hunger hormones, your leptin, your ghrelin, all that kind of stuff. So these are things that don't take time. What are you fueling your body properly with the nutrients that it needs? So just eating the correct food, that's part of your clinic day. You're not spending more time, you're going to eat anyway, all that kind of stuff. So if you figure out what your body needs, how much protein, carbohydrates, fats your body needs, you can map that to your favorite foods, and you're not taking much time doing that. Now, with any journey to kind of improve your health, we think about your metabolism, and in order to kind of optimize that, think about things like your daily activities, like your step count, all that kind of stuff. So be more aware of these things. Basically, you don't need 2 hours in the gym. Now, no one's got 2 hours in the gym to do every single day. Do you get what I'm saying? But there's really small habits you can do around your hydration, your sleep, your nutrition, and your daily activity that can move the needle a lot further than people think. People think you have to do a marathon or like do something crazy in the gym, but that's not the answer.
Yeah, so why do like gym phases and strict diets keep failing for clinicians?
It's because they're not created with the kind of clinician's situation in mind. So I had a client yesterday who spoke to me and saying that they were previously given like a 2-hour workout plan. And so we're perfectionists, right? So if you're told that this is what you need to do without it being tailored to yourself, then automatically you're thinking, well, I can't achieve this. You detach or you feel demotivated because you're a perfectionist. And so I think that's the reason why those things don't work, because you aspire to this high level, say you've got to do 2 hours a day for 5 days a week, and you've got to cut out all your favorite foods, XYZ. And if you can't meet that as a perfectionist, you just detach and say, well, I can't achieve this goal I want to achieve. So yeah, I think that's what happens to us.
Okay, so what does sustainable health actually look like as someone in health?
Yeah, really good question. I think sustainable health is basically I wouldn't start any plans, don't start anything in the new year if it's not something you stick to for the rest of your life. This means that how is it going to stick with your family life? How's it going to stick with your work life? Are you going to be forced to eat certain foods that you don't like eating? Are you going to have to be restrictive, all that kind of stuff? So there is going to be some changes that you need to make on a fitness journey. But the question is, if you have to eat like chicken breasts and dry food and all that kind of stuff every single day, can you do that for the rest of your life? So that's what I'd suggest. It has to be personalized to you, a plan between your circumstances that you can then take and run for the rest of your life, because things change. You might be like a registrar in one unit, you might be rotating another unit, you might be a consultant with multiple responsibilities, in the future. There's no point doing a plan now that wouldn't work for you at that stage.
Okay, how should healthcare professionals then think about health differently from the general public?
Yeah, no, it's a really good question, because as healthcare professional, we think about our patient care, we think about others, but not many times do we think that in order to give to others, we need to be at a certain place ourselves. So that gets neglected. So the change in mentality really is that this is an essential part of the care that we give to our patient. The fact that we're able to show up, the fact that we're not unhealthy, that we're not chronically stressed, that we don't have poor sleep, that we're not like, pre-diabetic or, at risk of these metabolic conditions, the fact that we're performing high performance, that permeates and actually affects the care we give to our patients, how we turn up as colleagues on our wards and all that kind of stuff. Ultimately, it's a better service all around. So that's the change where I really want to see, where that self-care is not selfish. That self-care is super important in the care that we give to others. That's the root to it. And if you don't look after yourself, how are you going to look after anyone else? How are you going to show up for anyone else?
What are the first few changes that you'd recommend for health professionals who want to get fit?
Yeah, so the first few changes, just start at the baseline. So what you start with is basically, what does my life look like right now? Basically, where are the gaps in my time, basically? So, originally I said that you have to have a strong why. So you've got that in mind already. So you start with, what are things like now for me? Where do I want to get to? Okay. And then specifically, it's about having a plan that is not restricted. So you're not forced to eat certain things that you never eat. I start with that. And then the next step really is, then if you're going to get a bit more technical, is just basically figuring out like the nutritional needs of your body, basically. So what I mean by that is that if you're looking to maybe lose a certain amount of body fat over a period of time, it's just literally figuring out, what does this look like for my, if I can map it onto my favorite foods. So if you give me an example of a meal, whatever meal it is, if that's your favorite meal, you can still have this meal, but construct it in a way that hits your macronutrient targets. That's the thing. Not just start with maybe what they're eating, but it's not just that. There's also things about your hydration. So we're really bad with healthcare professionals. We're really poor at keeping well hydrated. That needs to be optimized, because sometimes your body gives you signals that you're hungry, but you're actually thirsty. Also, so that needs to be optimized. Stuff like sleep, I mentioned before, that's super important. If your sleep is poor, it's as bad as having a bad diet, really. And the kind of sleep hygiene, but even all these things, just to let you know, like actually tracking it, if you actually tracked it, that is the step that you need to take, because subconsciously your body knows this is important. Like, for example, Abby, if you were going to track your hours of sleep, subconsciously your brain's like thinking, okay, like I need to try and get more hours next, the next night, or trying. So just tracking it and being aware of the numbers and being aware of what you need to do, that is usually that's a really good way forward. So to kind of summarize, is having a plan, knowing where you are right now, but also realizing that it's not just only about eating better or going to gym or that kind of stuff. There's things around around that you need to do and need to try and optimize.
Okay, awesome. I think that's where, yeah.